Our fourth speaker today is a reproductive endocrinologist. So you've already heard from a physician who's a mind-body spirit physician, a women's health care practitioner, an OBGYN, a nutritionist, and you've heard from an acupuncturist. And now I'd like to introduce you to Dr. Spencer Richlin. Dr. Richlin is a surgical director and a specialist in reproductive endocrinology at Reproductive Medicine Associates of Connecticut. In addition, he is division chief of reproductive endocrinology and infertility at Norwalk Hospital. He has a long list of credentials in the field of obstetrics and gynecology and is a lead author of the IVF section in Danbury's Obstetrics and Gynecology 9th edition. And he was recently voted as top doctor for 2008 by Castle Connolly and Patient's Choice Physician for 2009.
So no question about it. We want you to continue the things you're doing. Be it yoga. We love yoga. I do yoga. The other doctors do yoga. We do yoga at our center every Saturday. You want nutritional support is so important, like all of you talked about, vitamins and eating well to get yourself and get your body ready to try to become pregnant and do even better with us. And then after you're off and done. Meditation, energy. I know Beth does energy work. We want you to be balanced and feeling good, and then we can help you with other parts to try to bring it forward and try to help you get pregnant. Exercise, of course, acupuncture. We're into acupuncture. I agree with all the different discussions on acupuncture so far. We do acupuncture before and after embryo transfer. We think it's great. It makes our patients relaxed. What's the mechanism? Does it increase blood flow? Does it make people just relax for their transfer? You know, it works. We do regular acupuncture. We do laser acupuncture. So definitely a modality that we want you to do. And you even made a comment about doing acupuncture, you know, before you even get to us or while you're thinking about getting into reproductive care or while you're stimulating. It's a great idea. Support groups are great. The reason why I put support groups up was because I think when you're trying to get pregnant, you don't want to push away people from you. You want your team. You want everyone to come together and support you in getting pregnant because you're going to pull it off. So you want nutrition, acupuncture, all these cool things that are out there and that we've all talked about to be part of you rather than pushing them off. And I think when we're trying to get pregnant, we have stresses in our lives, and sometimes we want to push away everybody, but we want to grab our team together and say, and like you even said, you're the team leader, you're the boss. Women have intuitions that men don't even have. So you'll kind of call the shots, and your team will kind of guide you through. Decreased stress is obvious. We've talked about that. Stress increases adrenaline and different issues in your body that will help you not get pregnant as easily, potentially, and not do as well in some of the different therapies you do with your reproductive endocrinologist. So de-stress, and you can de-stress by utilizing all these different modalities, running, acupuncture, yoga. We want you to be in the right zone before you come through. And I kind of talked about this. We want you good now, later, and down the road. So all these tools are so important. I think all the healthcare professionals like me are realizing over time how important all these different modalities are. And one of my last slides, I'm going to kind of put it together and talk about that a little bit. You know, the infertility basics, you know, what do we think? What does someone like me think about when you're trying to get pregnant? Above and beyond all the things you're doing and you've got to continue doing, what are the things I'm thinking about besides, I hope you're in the zone when you're with us. I hope you're in nutritional form. How's your uterus? Is it nice inside? Is it a good place for implantation? Are your fallopian tubes open? And I'm going to talk about all these different issues as we go. How's your male? Is your partner taking CoQ? Is he on a vitamin? Is he exercising? Do we have a good sperm count? How about ovulation? Do we have regular cycles? Does a lady have a 28-day cycle? Does she not? That's important. Is she kicking out an egg mid-cycle? We'll talk about that too. Diet, stress, and all these different things can potentially make you cycle more regularly. And that's been touched on by all the speakers. We talked about tubal block tubes. HSG will determine if your tubes are open. I'll show you an HSG. A lot of times we're unexplained. We don't know why someone's not getting pregnant. They will be doing all the things they should be doing. Getting their body tuned up, working with us, getting evaluated, good tubes, good eggs, and we just don't know why. We'll talk about that a little bit too. But the truth is the reason why I'm here and my team is back there too is because we have to go beyond the basics. You know, tubes, eggs, sperm, that's fine, but we need you guys to be tuned up. You need your doctor to also believe in what you're doing, and we do. And I want to kind of tell you something anecdotal. When we do embryo transfers in the office, you can imagine that they're stressful for the doctors. We have embryos, we want to put them in the uterine cavity really sweetly, smoothly, and there's stress for us too because we want this to work so bad for you. And what I do at the time of transfer is I will do some mindful relaxation, or like a mini relaxation, take a deep breath, and kind of get myself relaxed so I can do a good transfer. Why did I bring that up? Because I want everyone to know that we're involved in this, and this is part of what we're all basically all about. So those are basic going beyond and getting other pieces. We want to be peaceful and kind of be ready to get going with us. So reproductive endocrinologists, we're out there. We basically want you to be doing everything you're doing holistically also, exercise, nutrition. But at some point you're going to potentially say, you know something, I want to come and see someone like me or the other doctors in my practice and say, okay, what's beyond? What else potentially could be going on? And so I put this up because if women are under 35, the American Society of Reproductive Medicine would say, you know what, if you're under 35 and you've been trying for a year, come on in. Let's go beyond some other things and say, you know what, how is sperm, how is eggs, how are tubes? And also, if you had other treatments before with a reproductive endocrinologist, you may decide to say, you know something, I'm going to meet up with another reproductive endocrinologist sooner than later to try for, let's say, baby number 2. Earlier evaluation, when would you come in, let's say before a year? You'd come in before a year if you were over 35, if your cycles were irregular. If you have irregular cycles, you may not know when you're kicking out an egg or you're ovulating. So you may be trying timed intercourse on your own and have cycles that are 30, 40, 50 days, and you don't know when the egg's going to pop out. You may decide to say, you know what, let's try to figure out how I can get my cycles more regular. And we all know getting the cycles more regular, diet, nutrition, exercise can do that. If we have a known uterine factor, uterine issue, endometriosis, we know we have tubes that are blocked, you may want to come in and let us help you work through that. Also, we know we have patients in same-sex relationships. We can use donor sperm. Or if you don't have a partner, we often use donor sperm and try to get family building that way. So we support all these issues. So I felt I just wanted to throw out some basics in reproduction. You can see the uterus here. You can see that on the ovary is where every month you will kick out an egg if you're cycling. We'll talk about that later. The egg's going to get picked up by the fallopian tube, so the fallopian tube has fingers which are going to pick up the egg and bring the egg into that portion of the bullseye of the tube. You have relations, and sperm will swim through the uterine cavity into the tube, fertilizing the tube, and then the embryo is going to travel down the tube and implant into the uterine cavity. So I wanted to use that as a framework as we move forward and talk. So when you come to a reproductive doc, what are the things that you're going to discuss, or what do you want to know as a consumer? What are the areas that you kind of want checked? And we're going to go through all of these. Uterine evaluation, how's my uterus, how are my tubes, how is my day 3 blood work? I want to talk about that because FSH was brought up by one of our speakers. Am I cycling, am I ovulating? All these will be brought up. You want to go through old records. You want your doctor to see what you've done in the past. You want, definitely keep your support system. That's where I want everyone to continue doing what you're doing with your nutritionist, yoga, acupuncture, and we can also help you with that too at our center. And confirm or disprove evidence of the physical problem. Let's look at tubes, cavity, eggs, sperm, and see what's happening. So here's an HSG. The HSG is a study that is to tell us if our fallopian tubes are open. What happens is we place dye into the uterine cavity. I'll go over there and show you in a second. And we push dye to see if the uterine cavity has the right shape, to make sure there's no polyps or any fibroids in the cavity, and also to make sure that the fallopian tubes are open. It's usually done day 7 to 12 of the cycle. We tell our patients to take Motrin. It can be crampy. And let me kind of walk over here. Over here you can see, for example, here's a speculum, here's the uterine cavity in this nice shape. You can see the dye, and you can see that we have nice symmetricality. You can also see the fallopian tubes spilling dye. So in this HSG, it's normal, and fallopian tubes are open. This is definitely a test if you've been trying a year, you kind of want, because you want to make sure, are my tubes open? Can I get egg and sperm to meet in the fallopian tube? Because if your tubes are blocked, you definitely want to move on to something else in addition to whatever else you're doing on top of assisted reproductive technologies. Male is important. We want our men to be fit. I think a lot of men are neglected. We want them to be in good shape. We want them to take a vitamin. We want them to get, like you discussed, good sleep, less stress. We want them involved. Basic semen analysis is something you definitely want. You want to make sure your male has 20 million sperm per ml. They move good. They look good. Usually we do 2 semen analyses. The World Health Organization says you need to have 2 counts on a man to really understand, is this count good, is it a little low? Again, we often will use donor sperm when couples come in and we don't have sperm to utilize to get pregnant. And I kind of put this up to remind me that we often will freeze sperm. So we have men, for example, who are away in the military and their wives are coming through and we can thaw their sperm and utilize them on a cycle. And also we are freezing eggs for women who don't want to get pregnant at this point or want to retrieve eggs, freeze them for later in their life. So kind of elective egg freezing is also very, very popular and we do a lot of it. So this is a very hot topic, this issue of ovarian reserve. And ovarian reserve, how I see it is, how good are my eggs? What is the thermostat of my eggs? How is my ovarian reserve? And there's a lot of tests out there to kind of give us an idea of how good are my eggs. And Nina talked about this too. It's not absolute. Do not let your doctors tell you, oh, I have a high FSH and this is not going to work. Just like you were saying, Nina. You've got to be open-minded, but it's important to at least get an understanding of, what's up with my ovarian reserve? You got to think about tubes cavity, male, health, and then you got to walk into, how are my eggs? So we get into the day 3 FSH. The day 3 FSH is done on day 3 of the menstrual cycle. Remember, day 1 of the menstrual cycle is full flow. And in a perfect world, you'd love your FSH to be under 10. As we know, it can vary. It varies month to month. It's an indicator of your likelihood of getting pregnant. It's not perfect. It's not absolute, but it's something to discuss with your doctor. A new hormone on the block is something called AMH. It is cycle independent, and it's another prognostic indicator of, how good are my eggs? You'd love the number above 1, but if it's under 1, you're still going to get pregnant. It's just another indicator of how aggressive do I need to be in giving you data and giving you the control of what you're doing. Antral follicle count is when you go to your doc and they ultrasound you on day 3 of your cycle, and they count the little follicles in your ovaries. We'd love you to have at least 6. Those little follicles kind of tell us how you may do, how you would stimulate in cycles that we do. We'll talk about that later. So these are very, very much so hot topic areas. They're not absolute. They're well known. First FSH paper was in the 80s. So it's something you want to know, but I don't want you to, if you have an elevated FSH a little bit, leave our office and say, okay, this is not going to happen. Because like Nina even said, this can happen.